Welcome to my channel. In this video, we are going to learn about rectus sheath. We are going to see about its introduction, features, formation, contents, and its clinical correlation. Rectus sheath. It is an aponeurotic sheath covering the rectus abdominis muscle. Rectus abdominis enclosed within rectus sheath. Rectus abdominis muscle enclosed within rectus sheath. Features. Rectus sheath presents anterior wall and posterior wall. Anterior wall, it is complete. Anterior wall is complete. It covers the entire extent of the rectus abdominis muscle longitudinally from the upper end to lower end. It covers the entire extent of the muscle from the upper end to lower end. Posterior wall, it is incomplete. Posterior wall is incomplete. Hence, it does not cover entire extent of the muscle longitudinally. It is deficient above and below. Above, muscle lies directly on 5th, 6th and 7th costal cartilages. Posterior wall of rectus sheath presents arcuate line halfway between umbilicus and pubis. In the middle of area between umbilicus and pubis, arcuate line is present. Posterior wall of the rectus sheath presents arcuate line. Below the arcuate line, muscle lies directly on fascia transversalis and peritoneum. Posterior wall, it is deficient above and below. Above, muscle lies directly on 5th, 6th, 7th costal cartilages. Below the arcuate line, muscle lies directly on fascia transversalis and peritoneum. Now let's see about its formation. Formation of rectus sheath differs from above downwards as follows. We will see the formation of rectus sheath above the costal margin, between the costal margin and arcuate line, and below the arcuate line. Above the costal margin. Anterior wall, it is formed by external oblique aponeurosis. Posterior wall, it is deficient. There are three flat muscles in the abdomen: external oblique, internal oblique, transversus abdominis. Above the costal margin, anterior wall of rectus sheath is formed by aponeurosis of external oblique muscle. You can see that there is no posterior wall of rectus sheath. Above the costal margin, posterior wall is deficient. Muscle lies directly on 5th, 6th and 7th costal cartilages. Muscle lies directly on 5th, 6th and 7th costal cartilages. Above the costal margin, anterior wall of rectus sheath is formed by external oblique aponeurosis. Posterior wall is not present. Posterior wall is deficient. Muscle lies directly on 5th, 6th, 7th costal cartilages. Between the costal margin and arcuate line, anterior wall is formed by fusion of external oblique aponeurosis, anterior lamina of internal oblique aponeurosis. Aponeurosis of internal oblique muscle gives anterior lamina and posterior lamina. Anterior wall of rectus sheath is formed by aponeurosis of external oblique muscle and anterior lamina of internal oblique aponeurosis. Posterior wall, it is formed by fusion of posterior lamina of internal oblique aponeurosis and transversus abdominis aponeurosis. There are three flat muscles: external oblique, internal oblique, transversus abdominis. Internal oblique aponeurosis gives two laminae: anterior lamina, posterior lamina. Anterior lamina, posterior lamina. Anterior wall of rectus sheath between the costal margin and arcuate line is formed by fusion of external oblique aponeurosis and anterior lamina of internal oblique aponeurosis. Posterior wall of rectus sheath is formed by fusion of posterior lamina of internal oblique aponeurosis and aponeurosis of transverse abdominis muscle. Below the arcuate line, anterior wall is formed by aponeurosis of all three flat muscles: aponeurosis of external oblique, internal oblique and transversus abdominis muscle. Posterior wall, it is deficient. Rectus abdominis Below the arcuate line, anterior wall is formed by aponeurosis of external oblique, internal oblique, and transversus abdominis muscle. Posterior wall is deficient. You can see there is no posterior wall. Muscle lies on fascia transversalis. Contents: muscles, arteries, veins, nerves. Two muscles, two arteries, two veins. Muscles: rectus abdominis, pyramidalis if present. Arteries: superior epigastric artery, inferior epigastric artery. Superior epigastric artery, inferior epigastric artery. Superior epigastric artery, it is a branch of internal thoracic artery. Inferior epigastric artery, it is a branch of external iliac artery. Veins: superior epigastric vein and inferior epigastric vein. Veins accompany arteries. Superior epigastric vein drains into internal thoracic vein. Inferior epigastric vein drains into external iliac vein. Nerves: terminal parts of lower 6 thoracic nerves. You can see the terminal parts of lower 6 thoracic nerves: 7th thoracic nerve, 8th, 9th, 10th, and 11th thoracic nerve. 12th thoracic nerve is known as subcostal nerve. Now let's see about clinical correlation. Flap of rectus abdominis. A flap of rectus abdominis muscle with superior epigastric vessels is commonly used in breast reconstructive surgeries following mastectomy. Mastectomy is the surgical procedure which involves removal of breast. In breast reconstructive surgeries, flap of rectus abdominis with superior epigastric vessels is used. Divarication or suppression of rectus abdominis. It usually occurs in elderly multiparous women. It usually occurs in elderly multiparous women. Multiparous woman is the woman who has given birth more than 2 times. It occurs due to weakness and stretching of rectus abdominis and rectus sheath. Due to weakness and stretching of rectus abdominis and rectus sheath. Epigastric hernia. Linea alba becomes weak in elderly multiparous women and chronically ill children. Linea alba is the line extending from xiphoid process to pubic symphysis. It becomes weak in elderly multiparous women and chronically ill children. In these people, when the intra-abdominal pressure is raised, it causes protrusion of extraperitoneal fat along with a portion of greater omentum. Let us now revise rectus sheath. Anterior wall, it is complete. Posterior wall, it is incomplete. Formation: above the costal margin, anterior wall is formed by external oblique aponeurosis. Posterior wall, it is deficient. Between the costal margin and arcuate line, anterior wall is formed by fusion of external oblique aponeurosis and anterior lamina of internal oblique aponeurosis. Posterior wall is formed by fusion of posterior lamina of internal oblique aponeurosis and transversus abdominis aponeurosis. Below the arcuate line, anterior wall is formed by aponeurosis of all 3 fat muscles. Posterior wall is deficient. Contents: it consists of 2 muscles, rectus abdominis, pyramidalis if present, 2 arteries, 2 veins, superior epigastric, inferior epigastric arteries, superior epigastric and inferior epigastric veins. Nerves: lower 6 thoracic nerves, T7, T8, 9, 10, 11 thoracic nerves and subcostal nerve. Clinical correlation: flap of rectus abdominis along with superior epigastric vessels is used in breast reconstructive surgeries following mastectomy. Suppression of rectus abdominis muscle, it usually occurs in elderly multiparous women. It occurs due to weakness and stretching of rectus abdominis and rectus sheath. Epigastric hernia, it occurs in people with weak linea alba. Linea alba becomes weak in elderly multiparous women and chronically ill children. In these people, when the intra-abdominal pressure is raised, it causes protrusion of extraperitoneal fat and a portion of greater omentum.